How do lung cancer cells develop targeted therapy resistance? Imagine fighting a battle against lung cancer with powerful targeted drugs designed to block specific molecules that help the cancer grow. But sometimes, the cancer finds ways to outsmart these drugs, making treatment less effective over time. This resistance happens through several complex mechanisms that allow cancer cells to survive despite therapy. One common way is through changes directly in the drug's target. For example, in lung cancer, mutations can occur in the gene for the epidermal growth factor receptor, or epidermal growth factor receptor. A specific mutation called T790M can develop after initial treatment with drugs that target epidermal growth factor receptor. This mutation changes the shape of the receptor so that the drug no longer binds effectively, allowing the cancer to keep growing. Sometimes, cancer cells may even lose certain mutations that made them initially sensitive to treatment, selecting for clones that can survive without the original target. Another way cancer cells develop resistance is by activating other signaling pathways that bypass the blocked target. For instance, if a drug inhibits the epidermal growth factor receptor, the cancer might turn on the MET gene or activate the Ras-Raf-MEK-HERK pathway. These alternative routes help the cancer continue to grow and survive, even when the main pathway is blocked. Cancer cells can also change their type altogether, a process called histological transformation. In lung cancer, some cells can switch from non-small cell lung cancer to small cell lung cancer. This change makes the cells respond differently to therapies and often makes the original targeted drugs ineffective. Within a tumor, there is also a lot of genetic diversity among the cancer cells, known as tumor heterogeneity. Some cells might have mutations that make them resistant to therapy, while others are still sensitive. When treatment kills the sensitive cells, the resistant ones can grow back and cause the tumor to relapse. The environment around the tumor also plays a role. Changes in nearby blood vessels, immune cells, and other surrounding tissues can create protective niches that shield cancer cells from drugs. Additionally, cancer cells can develop ways to pump out drugs more efficiently using drug efflux pumps, reducing the amount of medication inside the cells. Cancer cells can also adapt their metabolism. They might increase glycolysis, a process that produces energy quickly, or alter mitochondrial function, helping them survive even when targeted therapies are in use. Because of these many resistance mechanisms, doctors often need to monitor the cancer closely. Repeated biopsies or liquid biopsies, which analyze circulating tumor DNA, can help detect new mutations or pathway activations. Combining different drugs to target multiple pathways at once may help delay or overcome resistance. Sometimes, switching to different targeted therapies or adding inhibitors against newly activated pathways can improve outcomes. Understanding how lung cancer cells develop resistance to targeted therapy is essential for improving treatment strategies. It highlights the importance of personalized medicine, where treatments are tailored to the evolving nature of each patient's cancer. Always remember, if you or someone you know is undergoing treatment, consult healthcare professionals for guidance based on the latest scientific evidence. Staying informed and working closely with your medical team can make a significant difference in managing lung cancer effectively.